for high schoolers in Chicago, a different kind of class. This after-school program centering on the mental health of teens.
What a lot of people do is they cover it up.
Latrell Scott, who's 17, says adults sometimes don't get it.
In my experience as a teenager, they have quite literally shunned me, shunned my emotional state sometimes. And it's taken a lot of work to actually learn how to speak and be honest and open with myself.
Nearly half of high schoolers have reported feeling persistently sad or hopeless in the past year. Startling statistics that only begin to illuminate how deep the teen mental health crisis is in this country. It's why programs like this one exist, a partnership between Adler University and After School Matters, intended to help students connect with therapists and get access to behavioral health services.
The teens now are so much braver. I think they are demonstrating more openness to talk about their mental health.
The nation's top doctor visiting to see for himself earlier this month.
Mental health is the defining public health challenge of our time.
Should there be more investment in programs like these then? Is that the answer?
Well, it's part of the answer. And yes, there should be more investment there, because when kids do better, it doesn't just benefit their mental health. It doesn't just reduce chances of anxiety and depression, but it also improves how they perform in school. It improves how they show up for their family and their friends.
For Dr. Vivek Murthy, like for so many of us, it's deeply personal.
In my own life as a child, I struggled a lot with my mental health. I felt lonely at times. I struggled with anxiety, but I didn't know who to talk to about it. I felt this real sense of shame. And I look at my own children now, who are 4 and 6, and I don't want them to go through what I went through. I want them to know that if they need help, that it's okay to ask for help.
The Surgeon General sounding the alarm, issuing a rare public health advisory about the youth mental health crisis, and he's been working to elevate the conversation.
Just talking about it can be part of the solution, right? Raising the visibility, putting a spotlight on this matters.
It absolutely does. And we know that, we've got to change culture by having better conversations, more open conversations about mental health.
Conversations like the ones happening in Chicago, where nearly 8 in 10 students who participated said they feel more hopeful about their future.
If I want my life to get any better, then what can I start doing?
Like 14-year-old Claudine Agassinan.
If I'm really feeling down and I need someone to talk to, I have to go and talk to someone to make myself better.
More conversations mean stronger connections, mean better health. Hallie Jackson, NBC News, Washington.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.